Hello everyone, I'll be starting with restoration of endodontically treated teeth and it will be covered under the following headings. Introduction, anatomically, biological and mechanical considerations in restoring endodontically treated teeth. What are the factors to be considered while planning the final restoration? Post-endodontic evaluation of teeth, factors determining for post-selection, clinical factors influencing post and core classification of post crowns. Introduction. A successful endodontic treatment has to be complemented with an adequate post-endodontic restoration to make the pulpless tooth function indefinitely as an integral part of the oral masticatory apparatus. Endodontically treated teeth fail principally due to one of the following two reasons. 1. Persistent intraradicular infection and post-endodontic restorative difficulties. Anatomical, biological, and mechanical considerations in restoring endodontically treated teeth. These include the following: the role of moisture loss and nature of dentin, alterations in strength caused by architectural changes in the morphology of the teeth, concepts of biomechanical behavior of tooth structure under stress, biological width, protecting the remaining coronal tooth tissue, creating the ferrule, moisture loss, dehydration of dentin, and degradation of collagen are no longer considered to be a cause for endodontically treated teeth requiring a specific restorative procedures. Biological width. The biological width is preserved when the restoration is placed, allowing for approximately 2 mm for the connective tissue and junctional epithelium and 1 mm for the sulcus. Post and core. Crown ferrule. Definition. Ferrule is defined as a band of extracoronal material at the cervical margin of a crown preparation that encompasses the tooth and provides resistance form to the tooth. This is usually provided by the crown that is placed over the post and core system. What are the factors to be considered while planning the final restoration? Restorative treatment designs depend on the following: amount of the remaining tooth structure, functional demands that will be placed on the tooth, and need for the tooth as an abutment in a large restorations. Teeth with a minimal remaining tooth structures face the following challenges. They have an increased risk of fracture, they provide decreased retention for the retention, they are in jeopardy for invasion of the periodontal attachment. Core. The core consists of restorative management of the coronal portion of the tooth after the completion of endodontic treatment. The remaining tooth structure can also be altered to augment the retention of the core or to provide resistance to core rotation under function. Pins, grooves, and channels can also be placed in the dentin in a position removed from the post space. Materials used for core build-ups. They are direct placement and indirect placement. Direct placement, composite resin, amalgam, glass ionomer resin. If you come to indirect placement, they are casting. Post-endodontic evaluation of teeth. Anterior and posterior teeth function much differently. Therefore, they must be evaluated separately. Maxillary central incisors and canines, the design to place a post should be based on amount of the remaining coronal tooth structure, occlusion, and function of the tooth. Posterior teeth. The forces on posterior teeth are predominantly vertical. Endodontically treated posterior teeth should receive cuspal coverage, but in most cases do not require a post. A post is indicated in a posterior tooth only when other more conservative retention and resistant fractures features cannot be used for the core. Factors determining post selection. Ideal features of an endodontic post are: they provide maximal retentiveness to the core, physical properties compatible to dentin, maximum retention with minimal removal of dentin, even distribution of functional stresses along the root surface, aesthetic compatibility with the definitive restoration and surrounding tissue, minimal stress during placement and cementation, resistance to displacement, easy retrievability, material compatibility with core, ease of use, safety and reliability, reasonable cost. Clinical factors influencing post and core restorations are as follows: that is post length, tooth anatomy, post width, canal configuration, and post adaptability, post design, luting cement. Coming to the post length, post width, we have here some diagrams which are showing post length and post width, post diameter philosophies, conservation, preservationist, and proportionist. These are the diagrams which are explaining the post length and post width. Now coming to the classification of post, we have Walton and Torabinajad. According to the nature of fit, they are passive and active. According to the construction, custom made and preformed. According to the shape, parallel and tapered. And according to the surface configuration, they are smooth, serrated and threaded. Crown placement. Indications and contraindications we have here. Now coming to the indications, it is better aesthetics situations in which the structural integrity of the natural crown is compromised. Contraindications, anterior teeth only have conservative access opening. Crowns, advantages and disadvantages. Durable. Here the advantages of crowns are durable, they are good aesthetics, restoring dental function, good form and protection of tooth. If you are coming to disadvantages, they are loss of tooth structure and they are expensive. Anterior tooth class 1 to 3, they are complete coverage is not required. Conservative treatment resin composite is sufficient. If we come to class 4, complete coverage is required. Prefabricated fiber post with a composite core fill ceramic crown. Class 5 complete coverage is required. Again, prefabricated fiber post with a composite full ceramic crown we have to give. Next, posterior tooth, class 1 to class 3, conservative treatment only. For class 4, composite core fiber post, metal ceramic crown. For class 5, prefabricated fiber post, composite core metal ceramic crown. Thank you.
I conclude the session by saying that we hope this course was clear and informative. This will surely help you all in endodontic practice. Thank you.